colleague Adil Shamji, our critic for health in the Ontario Liberal Party, to talk about some very concerning, I don't want to say developments, but further developments in the Ford government's drive to more for-profit care in Ontario. And so we've seen over months and months the fact that Ontarians are having to use their credit card more and more often, not just their green card. So the most recent revelation that the former Minister of Health is actually lobbying on behalf of a for-profit agency to the people who were her direct reports a little less than a year and a half ago. That's deeply concerning. So it seems that in Doug Ford's Ontario, if you own a for-profit healthcare company or you own some land in the green belts or inside an urban boundary, if you're already rich, you're going to do well. But if you're an average Ontarian, you're going to have to pull out your credit card when you pull out your green card, and that's just not right. And I'll turn it over to Adil.
Thank you very much. Bonjour tout le monde. Good morning, everyone, and thank you very much for being here. We're here to talk about a very, very disturbing trend over the past months and weeks, and that is this accelerating trend towards privatization in healthcare that is unregulated, unethical, and unacceptable. Today, we're addressing the latest findings of inappropriate funding for public surgeries in a private for-profit hospital that officially and inappropriately has the most recent former Minister of Health lobbying on its behalf directly. Now, this happens within the context of way too many worrisome examples. We have runaway profiteering with temporary staffing agencies, where hospitals and long-term care homes are being charged 2 to 4 times the normal amount. The government had an opportunity to do something about this with my private members bill just a week or two ago, and they refused to take any action. This happens within the context of pharmacy primary care clinics, in which patients desperate for clinical care are forced to walk past aisles of glittering beauty products and seasonal decor on their way to access care. A physician or NP's office would never be allowed to do that. This happens within the context of bungled vaccine distribution by private distributors, notably Shoppers Drug Mart, that has seen serious supply issues, resulting in doses not even making it into communities. None of that should come as a surprise. Our Auditor General just last year pointed out that private sector vaccination wasted on average 24% of doses. In one case, 57% of doses. This government is allowing ideology to get in the way of quality care because lesson after lesson after lesson reveals that for-profit private initiatives consistently lead to poorer health outcomes. And so now, as though none of those things were bad enough, a new finding, that a private for-profit hospital, ClearPoint, has been getting awarded new contracts for surgical procedures and being compensated at a rate that is 2 to 4 times greater than what would be paid in the public system. The government could be investing in the public system to a greater degree, and yet Doug Ford consistently underspends by billions of dollars. And when he does spend any money, he funnels it into the coffers of profit-motivated corporations that deliver the easiest care for the highest cost. And on top of that, there is the additional new finding that the former Minister of Health, Christine Elliott, has been engaged to lobby on behalf of this for-profit private hospital, already charging 2 to 4 times. We have, put another way, we have a private for-profit company that is performing the easiest surgeries on the least complex patients during the most convenient times of the day with the least oversight, yet they get to charge the most to the healthcare system. And we have the immediate past health minister lobbying the current health minister on behalf of a company that is already profiteering in our healthcare to allow that company to profiteer even more. Doug Ford campaigned on cleaning up government, but instead he's just become the conductor on his own gravy train, yelling all aboard to every donor, friend, and corporation hoping to make a quick buck on the back of taxpayers. And just think about it. He faces the Greenbelt debacle an RCMP criminal investigation, the appointment of a special prosecutor, an urban boundary flip-flop, 3 ministers resigning, and now he's got past ministers helping current ministers plunder our healthcare system. In the wake of all of this, the Ontario Liberal Party is making the following calls to clean up our healthcare system. Number 1, we are calling on Christine Elliott to recuse herself from lobbying the Ministry of Health. We are calling for the amount paid to private clinics and private clinics for surgeries to not exceed the amount that is paid in public hospitals. We are calling for nurses and healthcare workers to be paid fairly, and we are calling for new funding for expanded, not-for-profit operating room hours. With those comments, we're happy to take your questions.
Have either of you spoken to the Integrity Commissioner or filed any kind of complaint to them about Christine Elliott's lobbying?
Not yet, and that technically, it may be permissible. The point is, she was the Minister of Health and the Deputy Premier for 4 years. So she will be lobbying not just the current Minister of Health, but it's inside the people who are her direct reports inside the ministry. And so at a time when we're trying to build up the publicly funded healthcare system, to not put more profit into it, to make it work better, why is the former Minister of Health lobbying for for-profit care? Whether it breaks the Integrity Act, I doubt that it does. But it doesn't pass the sniff test. No, not at all. And that's what we're trying to say is I think the right thing for Christine to do is to recuse herself from that. It's too close. Right? She was too powerful, and some of that power is residual, and it shouldn't be used for for-profit care.
Do I understand that it might be permissible because the Public Service of Ontario Act doesn't apply to her because she was a minister and not a public servant?
Yeah, I'd have to take a look at the cooling off period, but I would expect. I mean, if it's in violation of the members, if this, she's no longer covered by the Members Integrity Act, so it is the Public Service Act that would be the standard that you would hold it to. It's just not right. It's not right. She had too much power, and some of that power is residual. It stays with her, even though she's out of government. So it just actually, what it does is it just totally underscores the direction that Doug Ford is heading in, which is he's okay with Ontarians to have to pull out their credit card when they're using their OHIP card more and more and more. And that doesn't do the average Ontario family any good. It's certainly helping a lot of people who are already rich get richer, which seems to be Doug Ford's approach to government in general.
And so just so I'm clear, so if Christine Elliott does not recuse herself from lobbying the Ministry of Health, is that a next step then, going to the Integrity Commissioner, or what?
I'm not sure that the act would apply to her now because she's no longer a member. There may be some things in the Public Service Act, but however the laws are written, right? I don't know what the next step is. I do actually know what the next step is. The next step is for her to recuse herself. That's the next step. It's not right. She had too much power, and that power stays with her. Those relationships stay with her, and it's not right. And she should do the right thing.
The government has said that the payment structure for Don Mills has premiums in it, and that these premiums have been offered to other hospitals, and that they're necessary to incentivize them to do these surgeries to get the backlog down. What do you make of that explanation? Sure.
There are more than enough incentives. Again, I remind you, these are the easiest surgeries, the least complex patients at the most convenient times. Those incentives are already in place. And the reality is that whether they have or have not been offered in the past, currently public hospitals are getting paid at a significantly lower rate than these private for-profit hospitals are getting offered. And that is wrong.
Is this approach working? The government, a few weeks ago, Jones was saying that the backlog of surgeries and diagnostic procedures has gone down by something like 180,000 people since January. Isn't that not a sign that this approach is like an effective one?
Well, I regret to say that that the Minister of Health cherry picks her data, because while there may have been some improvement in the extreme long waiters, we still have hundreds of thousands, millions of people waiting for excessive long times. If we want to clear that backlog and also get value for our money, for our taxpayers, these services can be provided very clearly in a not-for-profit model within the public system, so long as that public system is adequately funded. And we see time and time again that the government commits money and then doesn't follow through on that. The most recent FAO report said that they had underspent by $1.7 billion. They still have not fully committed all of the money that was offered to them through the federal health transfers. We could have more PSWs in our system that would enable more people to go into long-term care instead of occupying acute care beds. The federal government has offered something like $1.7 billion that the province can tap into to pay and recruit more PSWs. They refuse to do that. There are lots of opportunities. There's lots of money available to the province to address these issues within the public system. They are refusing to accept any of these options and instead are funneling taxpayer dollars into the most expensive care.
So the one thing I'd like to add, just in terms of working, is in terms of things working, the calls that we get at the office where somebody says, I need cataract surgery, and I was just told that it would cost me $3,000, or I'm going to have to pay this much more for another lens. The long-term prospect for that is that the government will only continue to fund the minimum standard and not move up to the gold standard. And more people will have to use their credit card. I don't think Ontarians expect that out of their healthcare system. Or at least if that's going to happen, then the government has to articulate it very clearly that that's their intent. Because most of what's happening right now is by stealth. Nurse practitioners are at clinics that are charging membership fees because they're not covered under OHIP. So it's very clear that Doug Ford is moving in the direction of more profit in healthcare. It's that simple. And we don't believe that you can serve shareholders and the patients and still they can't share that. You can only serve one master, right? I think.
Adel, this question might be best for you. I'm looking at the CBC article right now about the Don Mills surgical unit and the amounts that it was being paid versus public hospitals. And it's being paid more than twice as much for cataracts and certain knee surgeries. In a public hospital, that amount that is being given for surgery, I would imagine doesn't take into account sort of the existing resources and infrastructure in a public hospital, whereas in a private care facility, I would think that a justification for a higher amount being given to them is to cover some more of that, I guess, extra. So, in your experience, in terms of talking about the discrepancy between $500 given to a public hospital for one surgery versus $1,200 to a private facility, is more than twice the amount needed to cover, the extra beyond the very specific surgery itself?
No, not even close. I mean, the reality is a lot of those extra things in public hospitals that you're referring to are fixed costs. You need a certain amount of equipment and that kind of thing. It doesn't take long before you've purchased that equipment. And in the current funding model, this increase, whether it's 2 times or going all the way up to 4 times, is in perpetuity for every single procedure. It does not make any sense at all.
So should then these additional costs with more private surgical, facilities participating in this way, should they be responsible for covering these costs? What sort of, the government is going to keep doing this, so what is the, I don't know, is there a middle ground here, or just should they be paid the same amount as a public hospital?
Let's remember, the asset that is a public hospital is owned by you and me and everyone in this room. The asset that is owned by a surgical clinic or a private hospital is owned by shareholders. So any money that goes to them is going to go to build equity and assets, capital. They own that. That's theirs. That's their profit. I think we've seen how that's worked in over the pandemic in long-term care, and how now some of those long-term care homes companies are getting out of the business of it because it's not as attractive as an equity investment. So we need permanence in our healthcare system. So we have public hospitals. They're great hospitals. We've built them up over decades. Yeah, there's a lot more work to do. We don't have enough people in those hospitals. That's what this government should be doing. We don't have enough workers. The government should be taking the money from the federal government, right, and building up our hospitals, building up that equity, the publicly owned equity in our public hospitals.
We have the Nurse Practitioner Association coming here today, I believe. I'm not sure what they're planning to say at their own press conference, but we've mentioned the clinic in Ottawa and the other ones that charge access fees. What do you think? Should nurse practitioners be covered by OHIP? Like, what do you think they should be? What should the funding model for nurse practitioners be?
Yeah, actually, we've been very clear on this, that when an Ontarian gets access to primary care, it should be covered by OHIP, regardless of whether that primary care is delivered by a family doctor, a nurse practitioner, or ideally, a primary care team. So for us, the answer is very clear.
Okay, I want to add something here.
Please.
So in 2017, 2018, somebody have to correct me on the date, we established 25, our government established 25 new nurse practitioner-led clinics here in Ontario. How many has this government established in five and a half years? Zilch. None. Zero. Nothing at all. That's the problem. I don't know what the inertia is in this government to build up the publicly funded healthcare system, but for them to do none in 5 years after the initiative was started, we all know it works. It's just wrong.
Back in September, the Attorney General mentioned that. Oh, okay. Something else. Okay, sorry.
Okay.
Oh, no.
The Attorney General mentioned that there was going to be a review of lobbying rules, and that was coming in, that was going to come in the coming weeks, and that was early September, and we haven't heard anything more about that. Why do you think that is, and what do you want to see come out of that review?
The government is very busy covering their tracks right now as far as lobbyists go, so I don't think they have enough time to turn their attention to what should be done here. Yeah, it should be looked at. I mean, just look at the mess that is this government with, all the land stuff with MZOs and the Greenbelt and urban boundaries and the stuff that we learn every day. I mean, it's incredible. And now you have a former Minister of Health lobbying the people who were her direct reports a year and a half later. Yeah, I think we need to look at those rules, and the government can't do it fast enough.
If Christine Elliott in this situation is an example of, I guess, a loophole in lobbying law, given that this review presumably will start of the Lobbyist Registration Act. Is that a loophole that you'd like to see closed?
Yeah, I think as a public office holder, if the Minister of Health goes back in to lobby in the same government, the people who are her direct reports, and not even necessarily in the same government, I think that should give people pause. There is residual power and relationships that are left there. And what it means is the person that she's lobbying for, and maybe the minister herself, I don't know about compensation, are taking advantage of those. I don't know if that's really in the public interest. I think it's fair to say there's a good chance that it's not in the public interest. So yeah, we should look at that. If you look federally at the cooling off rules, it's like 5 years, right? And they're pretty strict laws. I mean, here in Ontario, like what happened here in Ontario would never happen federally, ever, not under their rules. And some argue their rules are too strong, but I think they protect the public. And they were brought in under Stephen Harper. So what does that tell you? Thanks.
Thank you.
There's nothing. No calls. No calls. Just kidding.